Hi everybody, welcome to Healthline. I'm Gregory Zarian. Happy New Year. It's a new year. So what are your new intentions? What are you going to do this year that you didn't do last year, with last year being so different? Our intentions and our choices are obviously very different. However, our wish is to still wear your mask, socially distant, stay safe, be aware of people around you. And that does not mean do not go to the doctor. That does not mean do not call your doctor. That does not mean not paying attention to you and your health. With it being January, it is Cervical Awareness Month, and that means the conversation is all about cervical health, cervical cancers, and just passing on the information. The color for Cervical Cancer Awareness, Cervical Awareness Month, is teal, so I got my teal on. I am here to have the conversation. So I decided to bring in one of the best from Adventist Health Glendale, Dr. Sarah Harrington, OGBYN. How are you?
I'm great. How are you?
I'm good, thank you. Happy New Year.
Thank you. Thank you.
New Year, Cervical Awareness Month. First thing that comes to mind.
First thing that comes to mind is really reminding patients, hey, this pandemic, this last year has been really tough on everyone. But with that, this month our focus is on cervical health and maintaining health. Obviously we don't want to get COVID. We are all scared, to go out. Maybe some of us actually not scared enough.
Sure.
With some of the numbers we're seeing, but we're scared to go out. We're scared to go to hospitals because we might get COVID seeing our doctor. And we are taking great precautions. And one of the big things is actually still maintaining all parts of your health. Yes, wear your mask, do your social distancing, wash your hands. That's the biggest thing, honestly, washing your hands, making sure you're doing that. But really saying keep up with that health awareness. And for women, that really includes doing those cervical cancer screenings and maintaining that if that's something that you're due for.
And one thing too, before we already wrap out from our first little intro, is it's even just about having a conversation. It's about calling your friends. We talk a lot, we do a lot here for Breast Cancer Awareness Month.
Yeah.
And I always invite women, grab a friend, grab family, go get your mammograms together. So have a conversation with your friends, your family, talk to your mom, your grandma, your aunt, friends about cervical health, because something you may say may save somebody else's life. We're at our first break, so that means have a glass of water, stretch, take a few deep breaths in, a few deep breaths out, and we'll see you on the other side. Don't go away. Welcome back to Healthline. Adventist Health Glendale's emergency room remains open and safe for patients to visit, but consider one of the 2 urgent care clinics for symptoms like sprains, sore throats, sinus infections, and minor cuts. That will help ensure adequate capacity for life-threatening emergencies in the emergency room. For more information for urgent care clinics, please call 818-249-9454. The entire conversation today is all about cervical health awareness and Awareness Month, and joining us from Adventist Health Glendale is Dr. Sarah Harrington, OBGYN superstar.
Thank you.
Doctor, in the conversation we were talking a little bit, during our break we were talking a little bit about the importance of washing your hands, wearing a mask, taking care of yourself. But you also said something that I really loved, and that is?
Yeah, we may not be able to do all the self-care things that we want, I miss going to the spa and getting massages and, all those things that we have a great time, fun time. They're great for our mental health, physical health, and everything. But still, you can still go to your doctor. You can still make sure that you're doing all that preventive care that you really need. And, it's not the spa. It's not as fun as the spa, but come see us.
I know, like buy bath salts and buy a loofah sponge, because one thing we've talked a lot about during COVID is that a lot of patients are not going to see their doctor because they're afraid.
Yeah.
Got it. But there's now telemedicine, which you can actually get onto like a Zoom call with your doctor, have the conversation. It's between you and your doctor. So it's really, it's the next best thing.
Yeah, and it's great because, you know, you can get rid of some of your wait times.
Thank
you can
you.
be on there
You
doing
can
your
set- you
own
can set up
thing,
an
and then,
appointment.
you know, we
And-
get on with you, and it's super convenient. I've done it myself.
I've done it.
seen my doctor. Honestly, like, yes, I love to see people face to face. I miss hugging everybody and, you know, all that. But it's a really great option. We can do it also if, you know, for women who want birth control, want, you know, just regular health maintenance stuff where
Sure.
they don't necessarily need an exam, or if they're just not sure, hey, do I need an exam? Do I need this, or can I just, you know, get lab work and stuff and, you know, get that done without coming in?
It's kind of, and
we
here's
can
the
do
thing,
it.
when people complain about, oh, I got to go to the doctor, you save travel time, you save
Yeah.
gas money, you save all of this other time to have that quick face-to-face. And one thing that I really love that you're saying is, it doesn't mean with everything that we're going through, do not talk to your doctor, do not call, do not, even if you have something on your elbow that you're not sure what it is, pick up the phone,
Yeah.
teleconference, do whatever to have that conversation.
Yeah.
Because one thing that I did is doing some research is a lot of cervical cancers, and I say cervical cancers, don't have signs and symptoms.
Yeah, exactly.
You know, my sister-in-law was diagnosed with stage 3 ovarian cancer a couple months out because she had pain
Yeah.
and not one sign or symptom.
Yeah.
So, and she's over 60, which doesn't mean it doesn't mean don't go in, make appointments, get checked and do everything
Yeah.
you need to do. It still means having the conversation.
Yeah.
So let's dive into cervical health.
Yeah.
What does that mean, cervical health?
So, you know, cervical health is basically all about preventing getting that cervical cancer. Part of that is getting vaccines. You know, we're all talking about whether we can get the COVID
Sure.
vaccine right now. But there is an HPV vaccine which prevents most all cervical cancer.
And when you say HPV, please share with everyone what
So,
that is.
yeah, so HPV is human papillomavirus. It's extremely common. You know, there's over
For men and women.
both for men and women.
Do you hear that,
excellent
guys?
point. Yeah.
Men and women.
Yeah, and you know, honestly, even as an OBGYN, I learned something preparing to talk with you about this, that I always thought for men and women, you know, women could get vaccinated up to when they're older. They just recently changed it about a year and a half ago to be up to age 45.
Wow,
But
okay.
that guys only could get vaccinated when they were 11 or 12.
Wow.
So middle school.
Okay.
But when I was reading about this, I actually read the fine print more, and guys can also be vaccinated and help protect their partners, as well as protect themselves from things like oral cancers, anal cancers, other head and neck cancers, multiple cancers that HPV can cause. But for women, you know, if you're vaccinated, you can help protect your partner and your loved one. Hopefully it's your loved one.
True.
You can help protect them by being vaccinated.
But one thing I want to say too, and this is me just looking into everyone's eyes,
Yeah.
just because you get vaccinated for this doesn't mean that you're covered on that. There's such a
Yes.
huge conversation when they say,
Yes.
yeah, there's Truvada is an HIV drug. And people think, oh, I'm on Truvada, everything is safe here
Yeah.
because HIV, men, women, everything in between. There's other STDs you can get.
Yes.
And bottom line, that just means being aware, being safe, having a conversation. If you have
Yeah.
any questions, don't be sexual with the person that you're with.
Yeah, be your own advocate.
I love
like,
that.
ask, you know, there is no shame in asking whoever you're with.
It's saving
Get
your life
tested.
game. And
you know?
having a conversation.
Yeah.
Because if you're being intimate with somebody and not being open about it,
Yeah.
you're starting that relationship with a withholding.
Yeah.
And I'm going to tell you, it's not going to last. So
Yeah, it's not.
it's not. Because we're already at our, gosh, I could talk to you forever, because we're already at our first break. In regards to, let's wrap out on that, in regards to just being aware sexually and
Yeah.
cervical cancers and STDs, what is your comment to everyone?
If you're not in a monogamous relationship, you
Say
know,
no.
either you shouldn't
Or have the conversation.
either you shouldn't be having sex. You should have that conversation. But definitely condoms, you know, vaccines can help. Other things can help, but condoms, you know. And it's not to like minimize your fun. It's to make you stay alive. really in the long run.
Wow, I love that. Okay, so on that note, maybe you have to make a phone call, and maybe you just have to be one with you. And as Dr. Sarah just said, it's just about a conversation. You're not afraid about talking, you're afraid about the reaction. So maybe be afraid of the reaction before you have the conversation, because at least you know what you're going to get. More on the other side. Don't go away. Welcome back to Healthline. Joining us is OBGYN specialist from Adventist Health Glendale, Dr. Sarah Harrington. Before we dive into saving more lives and cervical health, give us a little bit of your medical background, please.
Yeah, so I basically did pretty much all my training at Loma Linda University.
Okay.
I did a brief stint up in Bakersfield at the Kern County, now it's Kern Medical. And then I came back to Loma Linda to finish my training when the opportunity opened. So, you know, just recently came out here to Glendale to start at Glendale Adventist.
What got you into women's health?
Honestly, it was what made me the most happy, and I loved being able to talk with women about, you know, really empowering themselves to,
Love that.
you know, to say, okay, maybe I'm a teen mom, maybe this, maybe that. Let's step back and say, you know, what are my goals for my life? Not just, you know, what medication should I do right now, what, you know, but really talking to people more about what do you want for your whole life? What are your hopes and dreams? And sometimes, you know, when I ask people that, that's when they like really break down crying, their walls come down, and they're like, you know what, actually, this is what I want. And then it's like, okay, now we can figure out where to go with your health.
You know, that's moving me for the fact that even when you said about being a teen mom, there's no shame in that conversation.
Absolutely not.
If you look at the facts, you then find a solution.
Yeah.
And we're all human beings, and we're all human doings, and we've all made mistakes that we
Absolutely.
recover and bounce back from.
Yeah.
It's the living in the shame of, look what I did and how bad I am. Well, no, look at what you did. What can you do? And then you take your story and pass it on to help other people. That's why I think that so many of the conversations we have with women and women's health are so motivating, because women talk more than men. You know, a lot of the things men go through is, you know, we've talked about, you know, a man not being able to keep his erection, or if there's blood in his urine, or the lack of all of that. More men get cancers, you know, prostate cancer, colon cancer, all of that, because they don't talk about it.
Yeah.
Women are a lot more open about what that is, because men think, oh, I've got to do this. Just talk. All we're doing is saying, hey, here, this is for you to help me with.
Yeah, it's all about having the conversations.
And it's about being fearlessly honest with your doctor. And if you're afraid, and you're younger, and even as Dr. Sarah said, you know, teen mom, talk to your parents, have questions, talk to your siblings. The more you know, the stronger choices you're going to make. As I segue into just, we're human beings, and we make mistakes, and we make choices, and what we do from those choices that we make. Cervical health. I'm just going to throw it out there. There are different types of cervical cancer. I did some research. We talked about HPV. Every year in the United States, close to 6,100 deaths. That means one death every 90 minutes. And those numbers can change the more you have a conversation, the more you suit up and show up and do the right thing for you. Other cancers are, I wrote this down, ovarian cancer. There are no signs and symptoms for that, are there?
Not really. There's no, and the tough thing with ovarian cancer is there's no screening, really. If you have a family history and you have some, you know, genetic markers, there might be some screening options, but even that's not great.
But that also means talking to your mom, talking to your grandma, to your aunt,
find out about your family.
Cousins, even
Get to
your
know
dad.
your family.
Can
It's
I
a
tell
good
you, that's
idea.
one of the best gifts of COVID. Get to know the people you say I love you to.
Yeah.
I heard weight loss, weight gain, and pain in the abdomen area.
Yeah, sometimes feeling like bloated,
Okay.
things like that can be sometimes a sign of ovarian cancer.
But go ahead.
Generally, you don't have any symptoms until you have it. Same with cervical cancer, but the good thing with cervical cancer
Yes.
is we have screening.
Okay.
And that means, getting your pap smears. And
Getting pap smears from what age on?
yeah, so from age 21 on
Okay.
to 65.
Unless there's a pre-existing condition with a mom, aunt, or grandma, would a young lady have a pap smear before that or no?
No.
Okay.
So pretty much there's no real, reason to have it before then, even if it's sexually active, because let's face it, before 21, our immune systems are rock stars.
Sure.
So,
Boom.
yeah. Before 21, you might get exposed to HPV
Okay.
if you're sexually active. Most often, your body's going to clear it.
Got it.
You still got a really good chance of clearing it if you're exposed between 21 and 30, which is
Okay.
lucky because a lot of us are still figuring out life.
We are.
But starting at 21, women need to get pap smears every 3 years.
Okay.
And then, depending, it can go to 3 to 5 years, depending on if everything stays normal.
So there's not a pap smear?
Not every year.
Okay.
So that annual visit, you should still come see your doctor, check up on other things. There's so much else that we do. With COVID, there's so much, honestly, mental health stuff that I do in my clinic. I joke that I'm a gynecologist at times, and it really feels true.
Because you're probably also dealing with young ladies that, are in their early 20s or teens
Yeah.
and that are having these crushes, and COVID has squashed so much.
Squash so much of
Let
our
me
lives.
just say this, girls. It's about getting to know the guy. It's about asking questions. It's about old school courting.
Yeah.
It's about getting to know the one you're with.
Yeah.
Thank you.
Yeah.
Okay.
Yeah, so with the screenings, one of the reasons it changed instead of doing it every year is because now we can check for HPV. We
Got
can
it.
check for some of those high risk types of HPV that cause almost more than 90%. We think probably really close to 100% of all cervical cancer.
Great.
And so we can actually check for that now. So still come see us. We want to deal with everything in your life and in your health. But those actual pap smears and HPV screenings only have to be every 3 years.
I love that. More Dr. Harrington when we come back. Don't go away. Welcome back. Do not let your guard down as the COVID pandemic continues. Please wear your mask, wash your hands, 20 seconds. Sing your favorite song for 20 seconds. Who cares if you irritate anybody? Watch your social distance. Stay home if you're not feeling good. Just be aware of people around you, in front of you, and take care of yourself. One thing we hear a lot here on Healthline is that people will actually go in to see their doctor. They will tell their doctor they are feeling just great, and they'll have a face-to-face. An hour and a half, 2 hours later, the doctor will get a phone call from the patient. Oh, by the way, I'm not feeling well. Completely irresponsible and mindless. Your doctor and your healthcare worker, the people that we salute at Adventist Health Glendale and all over this country, are there for us. The healthier they are, the more answers we get, and the quicker we can say goodbye to COVID and get our lives back in a new, great, more mindful way. I am now off my soapbox. You know what to do. Joining us from Adventist Health Glendale is Dr. Sarah Harrington, OBGYN superstar. Did you like my soapbox?
Mm-hmm. I love your soapbox.
Doctor, so people come in, they see you, girls come in, they do their pap smears, they get screened, and just say something comes back abnormal. Talk to us.
Yeah, so for patients who have any abnormality.
So when I say abnormality, what does that mean?
Good point. So there can be a couple different things. One abnormality that could come back on a pap smear is a positive HPV test.
Great.
The other is
I don't mean great for the positive test. I
Yeah,
just mean
no.
that you find out. Because here's the
It's
thing.
great to find out. Knowledge is power.
Knowledge is tons of power, yes.
Yeah.
All power.
Yeah, so the other thing that could come back abnormal is when the pathologist looks at those cells from your cervix under the microscope, does special stains and everything, and says, hey, these aren't quite looking healthy. There's something a little off. That would be another abnormal type of result.
So then what happens then?
So the biggest thing that you need to know is you need to follow up. Each person's different.
So
depending
so a
on-
lot of people will get an abnormality and not follow up.
Yeah,
Wow, okay.
Yeah. A lot of the time, and it's completely understandable. We all want to be avoidant. We don't, if we ignore the problem, it's going to go away.
And you get scared. Bottom line is you're scared.
Yeah, and it's very scary. But the biggest thing people can do is don't ignore it. Don't ignore it. This is your health. Cervical cancer is incredibly preventable. It's incredibly treatable even if it's early stages. So say, we catch it early, the treatment is so much less intense, so much less devastating and tough to go through than if it's later on. So the sooner you follow up, the sooner you get in there and you say, what do I need to do? And we get on that path, that's the best thing you can do for yourself.
I'm going to laser these questions in regards to cervical cancers.
Yeah.
Are there any signs and symptoms that anybody should look for?
Generally, no.
Okay.
Symptoms that could occur
What if there's blood in the urine?
Could be bleeding with intercourse.
Okay.
Or after intercourse.
Okay.
But there's so many benign conditions that can also cause that. So everything's kind of non-specific.
Sure.
That's generally the only ones. Sometimes there could be pain.
Okay. Like my sister-in-law.
Yeah.
And bloating.
There could be. Generally, that would be much later on.
Okay. Weight loss.
Yes, if it's starting to spread elsewhere.
Okay.
So if you're having those symptoms, go to your doctor right away.
Sure.
But a lot of the symptoms, they're very non-specific.
Okay.
They don't necessarily mean you have cancer, but it does mean you should get a checkup, make sure everything's fine.
And that also means too, don't self-diagnose. Google is the best and worst for everything.
It is. Yeah.
The other cancers I came across: ovarian, uterine, vaginal, and vulvar. Those are all the types of cervical cancers that you look for.
So those are all the types of female cancers.
Female cancers.
So the ones that are affected by HPV, like cervical cancer, would be the vaginal cancers and vulvar cancers.
Okay.
Those are also caused by HPV.
Is anal cancer caused by HPV?
Anal cancer and oral cancers and certain head and neck cancers.
Got it.
So you're welcome, ENTs. Those are also caused by HPVs.
How to prevent? Give us some great preventions then.
Yeah. So, biggest prevention, get your vaccine, safe sex practices, be choosy, be picky.
Love that.
You are a person that is worth it. You don't need to be with everybody on the block. Not to be too
no, but
too over
COVID
the
is
top,
a great. Can I tell you, in regards to COVID and where we are in the world, you have to get to know people in a very different way, and you girls ask the right questions. And if somebody seems a little creepy, turn off your computer, get off your phone, make different choices. In a great way, it's going back to the old school.
Yeah. Be picky, be choosy, make him get the STD testing, make him do that. Check if he's got vaccinated against HPV.
And here's the thing, see the results. The proof is in the paperwork, everything. And guys, ask the girls the same thing, family history. Talk to us about smoking, alcohol, all of that.
Yeah. So a lot of women, when they have an abnormal pap smear or they have HPV, they come to me and ask, what can I do to fix this? And they've studied so many different things. We think with COVID, there's vitamin supplementation, all these great things that are helpful. Unfortunately, for cervical cancer preventing that abnormal pap smear from becoming a cervical cancer actually isn't affected by any of that. The one thing that affects it, the only thing, is smoking. So not smoking. If you're smoking, quitting smoking, I will help you quit smoking.
I will help you quit smoking.
Yeah, many patients, I have done all the treatment for them to quit smoking. And sometimes that's what patients need to get motivated. And if that's the case, we're here to help you with that. Not just here to help you with your cervical health, but also smoking affects everything. But that is the only thing that we found, that all the studies say, quit smoking, never smoke preferably, but if you smoke, cut it out as soon as possible.
Last 3 seconds, what's your final thought in regards to cervical health?
Go see your doctor, have those conversations, find out what you need to do your screenings.
Will you come back?
Yeah.
You're awesome. Thank you, Dr. Harrington. Okay, so bottom line, have a conversation. Talk to your mom, your dad, your aunt, your grandma. Find out about your family history. And here's the thing, bottom line, have a conversation, period. It's about you and your health. You can find us on all types of social media. Facebook at AH Glendale, LinkedIn, Adventist Health. You can also find us on our YouTube channel, and you can find all you need at adventisthealthglendale.org. Be safe out there. Wash your hands, social distance. Be mindful of everyone around you. The most important conversation you're going to have is about you and your health, and I want to talk to you for a really long time. Be safe, be well, and we'll see you next time. Happy New Year.